All right, thanks everyone for joining us again here today. I'm joined by Working? G'day. So we've officially reported 5 new cases today, all locally acquired. There are currently 54 active cases of coronavirus in Victoria. I can also advise that there are a further 6 locally acquired cases that came through after the late night cutoff, and our public health teams are urgently investigating and interviewing these cases. We'll have further details about those cases in the CHO release and in tomorrow's update, but any exposure sites will be posted on the website over the course of the day. So of the 5 cases formally reported today, 2 relate to the City of Whittlesea outbreak. 1 is a contact of a previous case linked to the Star car wash, and 1 source of acquisition is still under investigation. We're now managing more than 4,200 primary close contacts across all of our exposure sites. We've also had 43,874 tests and 16,752 vaccine doses yesterday. There are a significant number of further exposure sites linked to the positive cases that have been published online overnight and this morning, including a number of Tier 1 settings, and Jerome will take you through those in a moment. I want to give a particular shout out to the thousands of staff running our testing and vaccine sites across the state. They're doing a great job and supporting a huge number of people, many thousands of people coming through. I would ask everyone to be patient and also respectful of those staff. They're doing their absolute best to protect you and to protect our broader community. The challenge ahead of us is a very, very significant one. In the past 24 hours, we've identified many more points of concern, in addition to the very worrying cases in private aged care. We're also very concerned about the number of other high-risk exposure sites, and we're seeing a small number of cases infecting a large number of contacts. There is no doubt that this situation is incredibly serious. The next few days remain critical, and I want to be really clear with everyone that this outbreak may well get worse before it gets better. So I'm asking every single Victorian, if you have any symptoms whatsoever, please go and get tested. Check the exposure sites regularly, and please keep following the rules to keep you, your family, your community, and everyone in Victoria safe. This is not over, and we need to keep going. So I'll now ask the Minister for Health to update us about the response to cases in private aged care settings, and then Jerome will take us through the details around other cases and exposure sites, and then we'll go directly to questions. So Martin.
Well, thanks, Acting Premier. So unfortunately, 3 of today's cases relate to the emerging outbreak in our private residential aged care sector. 1 is the son of the initial case. You'll recall the first case in Maidstone, Arcare, so it doesn't actually work at the facility but is clearly directly linked. 1 is a staff member at that same Arcare Maidstone who worked alongside that initial case. She was not vaccinated. She also worked at another aged care facility, the Bluecross ACG Sunshine facility, on the 26th, 27th and 28th of May. That has therefore triggered a strong public health response at the Bluecross facility, similar to what was activated to contain measures at the Maidstone Arcare facility. And the third additional case linked to the Arcare outbreak is unfortunately a resident, a woman in her 90s, within the Arcare Magnolia unit, the workplace where the initial case worked. She is asymptomatic and is being transferred to a separate hospital that we've established precisely for this risk. Our thoughts are clearly with the residents, with the workforce, and with the communities and families that they're all a part of. As indeed our thoughts are with everyone who is impacted by this virus. Currently, as the acting Premier has indicated, there are more than 50 Victorians living with the virus right now, but there are many, many thousands more as either primary close contacts or secondary contacts, doing it hard for all of us to stay safe, and I want to thank them. The fact that this outbreak has crept into a number of private residential aged care facilities is obviously of very great concern to the Victorian Government. It's of very great concern to all Victorians and indeed to the Commonwealth Government. Here in Victoria, we are very grateful for the support that has been put in place, be that from the Victorian Aged Care Response Centre, a joint partnership between the state and the Commonwealth. We're grateful to the Western Public Health Unit that has taken the lead in a number of response measures, and we're grateful to the Commonwealth and others who are working in partnership with us to respond to the outbreaks in private residential aged care. Since the start of the pandemic in 2020, we have put in place additional rigorous measures to protect our residential aged care facilities, our staff, and most importantly, the residents. Whilst, of course, the Commonwealth is responsible for the regulation of private residential aged care in Victoria, Victoria has sought to assist that sector wherever we possibly can, including through the extensive on-ground support provided by our healthcare workers, who have now completed more than 5,000 shifts of the state system assisting those private residential aged care services, and which are indeed on the ground as we speak. We have also had in place, in regards to the public residential aged care system, a rigorous system in place since 2020, where we've continuously deployed a subsidy for our public residential aged care workforce to make sure that we reduce the number of crossover shifts between workers across different facilities. That has resulted in all of the metropolitan public residential aged care facilities making sure that their workforce is dedicated to one facility, and in the high 90% in the regional public residential aged care facilities. We also have in place the $450 test isolation payments, so staff members can be compensated if they stay home whilst they are feeling unwell and can safely isolate whilst their test results are coming through. All, both public and private residential aged care facilities, have all been linked into one of our 8 health service hubs that we've had established since mid-2020, and they are the public sector health leads in each of the regions, and it is their job to work closely with both public and private residential aged care facilities on the important issues around infection prevention and control and lending the assistance where they can. And as a part of that, more than 12,000 staff have already taken part in personal protective equipment training, guided by expert advice and evidence, so as how to make sure that you are protected at work and that you keep yourself safe and you keep your residents and your family safe. So this is a very serious position for our aged care sector. Victorian Government is committed to working cooperatively with the private residential aged care sector, with the Commonwealth, to get ahead of this, and I might ask Jerome to take us through a few more of the details.
Thank you, Minister, and good afternoon. Over the last 7 days of this outbreak, we've seen over 275,000 Victorians come forward for testing. Over that same period, we've delivered over 95,600 vaccinations through our state clinics, now making a total of 476,000 vaccinations delivered since the start of our vaccination programme through our state clinics, part of the 1.1 million doses allocated to Victorians in the last few months. And my thanks in particular, of course, to everybody working in the vaccination stations and the vaccination centres over a very busy 7-day cycle, and of course our GPs all across the state, who of course are a critical part of the vaccination effort. As the Acting Premier has said, over the last 7 days we've also identified over 4,200 primary close contacts. We're continuing to see a very encouraging set of negative results come back for those primary close contacts. Over 77% of those identified have already returned a negative test result. And of course, with the huge numbers of tests going through the system, we're continuing to see that number go up. And we have now 279 exposure sites. Those numbers continue to rise. There are a number of particular exposure sites that I'd really like to draw people's attention to. This includes JMD Grocers on High Street in Epping, the Healthy India on Broadway in Reservoir, the Inde Filipino store in Footscray Market, and the Thai Hai Butcher also in Footscray Market. These, and of course a number of the other Tier 1 exposure sites we have out on our website, are really important to us. We really want to establish who's been to these locations, capture as many people as possible, and make sure we get them tested and isolated as swiftly as we can. We've talked over the last few days about a number of other leading lines of investigation. We talked about a number of pubs and clubs venues. Again, we've seen a really good response on those. Over 730 primary close contacts have now come forward. Over 3/4 of those have now returned a negative test result, and that is a very encouraging sign for us. We have a number of local food markets, local grocery stores, around 15 units in particular, that we've been working with over the last few days. Again, 60 primary close contacts identified in those small stores. 83% of those have now returned a negative test result. We've looked at a significant party, a birthday party at the Grand in Epping last weekend. 186 primary close contacts. Over half of those, over 100, have now returned a negative test result. And the students and staff at Mount Ridley College, we've got around 700 going through the testing programme at the moment. There are 30 of particular interest. Of those 30, 23 have already returned a negative test result. So on those leading lines of investigation, from a point of view of community engagement, response, contact tracing and follow through, we are making very, very solid progress, but there remains more work to be done, and we're very keen to close those remaining gaps to make sure we've got a lock on those particular lines of investigation. The Minister has referred, of course, to our major concern at the moment we talked about yesterday, of course, which is our aged care outbreak that we're now working with. We have now tested 70 staff in the Arcare unit that we identified yesterday. Of those 70 staff, 69 have returned a negative test result. 1 has returned a positive result. We have tested 76 residents. 1 resident has returned a positive result. The other 75 have returned a negative result. So we have an ongoing, of course, a lot of work to do, both at the Arcare in Maidstone, as well, of course, the Bluecross in Sunshine, where there is a staff member who overlaps between those two locations. And we'll continue, of course, to support our colleagues in the aged care sector and the Commonwealth to follow through on those issues. With regards to the wider vaccination programme, 38 clinics are open today. We are continuing to run extended hours. We saw a really good turnout at the weekend, over 16,000 vaccinations done yesterday compared to the normal 2,000 or 3,000 that we see, so it's a really, really strong effort. We are seeing particularly strong queues and busy queues in the morning, but the afternoons are fairly quiet. So please, we'd encourage you, for those people who want to walk up for your AstraZeneca vaccine, if you're over 50, you can do so. Please check the queues during the course of the afternoon. They are significantly shorter. We would like to make every utilisation of the capacity that we have. We want to get as many people as we can vaccinated through those clinics as we possibly can. And of course, a big shout out to the GPs who continue to do their part. And I know many GP surgeries are so busy at this time of year. My thanks to all the work they're doing to get as many vaccines through as we possibly can. I would just also have a reminder, it is critically important for those people who want to get their vaccine done. It is so important that you feel well. If you have any symptoms whatsoever, do not go to a vaccine centre. Go and get yourself tested. Let me repeat, if you have any symptoms, if you're a primary close contact, do not go to a vaccine centre, go to a testing centre, get tested and isolate. We cannot afford the risk of people who are potentially symptomatic going into our vaccination centres. It's critical that only those who are healthy and well get to the vaccine so we can actually move ourselves forward. Finally, from the point of view of testing, of course, we're seeing phenomenal demand for testing, and again, I add my thanks to those of the Acting Premier for all the staff and pathology teams working to sustain sort of this incredible rhythm in our testing operations. 210 sites are open. We have a particularly large site at the showgrounds, 8 lanes. If you are, you can, as of course was one of the reasons to leave your home, you can leave your home to get tested. If you need to cross the 5K boundary to get to the best testing centre for you, that is okay. But please, let's make use of all the capacity we have out there. I would particularly encourage the following people to get tested. Anybody, anywhere in Victoria who has any symptoms, no matter how slight, please come and get tested today. If you've been to any of the exposure sites, and please check again, they change all the time, and particularly those small local grocery stores in our northern suburbs, if you've been to those locations at any time in the last 2 weeks, please come and get tested today. And if you're one of the fantastic workers in our aged care sector, if you have not been tested in the last few days, we'd encourage you to please come forward and get tested. The more information we have, the quicker we can run this emerging outbreak to ground in that sector. Finally, my thanks to the whole Victorian community. I know this has been a really challenging week. We've seen a phenomenal response from people in terms of testing, in terms of vaccination, and of course in adopting those COVID-safe behaviour. We have more work ahead of us. We are making phenomenal progress of the work that we have to do so far, and we need your support over the days ahead to make sure we continue this progress. With that, the Acting Premier, Minister, Chief Health Officer and I will take any questions. Maybe.
Question for Brett, if I could. Right now with these numbers ballooning, we're going to be extending the lockdown beyond Thursday? It's a day-by-day prospect, but as the Acting Premier said, these are concerning numbers, these are concerning settings, and we've gone from 1 case at the beginning of this month to 4,200 primary close contacts. It's been a rapidly moving virus, and the transmission that's occurred in those high-risk settings has been very substantial. So we have to take it as a day-by-day prospect, but with more numbers today coming through, and those really concerning settings, especially in aged care, we're neck and neck with this virus, and it's an absolute beast. Victoria be preparing for more bad news? Look, we have to prepare for anything. We don't know what will unfold over coming days. We've said that all the way through, and we interrogate the data very deeply on a day-by-day basis. We could get very reassuring news through the rest of today, but we've had stuff come to us in the last 48 hours. It's very concerning. We have to bear that in mind.
You had a lot to say about contact tracing last week, and contact tracers in particular being overwhelmed. How has that been resolved? So it's not been overwhelmed. It's been a huge response. We've got thousands of primary close contacts being followed up, but they're being followed up in absolutely record time, and people are isolating, quarantining appropriately. They're being tested. Their primary close contacts are being tested. And secondary close contacts are being released when those other contacts are testing negative. So that's all working to plan, but it's very, very rapidly evolving, and the numbers are huge, and it just speaks to how infectious this virus is.
Here in Victoria, we have first-hand experience of how dangerous it is when COVID gets into aged care homes. And I guess given how the federal government has been so slow to roll out vaccination in private residential aged care facilities, do you think it's appropriate for Victoria to have, I guess, a state-based public health intervention and start taking over or start assisting with the vaccination of private residential aged care residents?
So we'll work with the Commonwealth with whatever assistance they may desire of the states. The Minister has made that clear. We are ready and willing to assist with whatever requests might come through. The reality is we've been open to vaccinate private aged care workforce for the last 3 weeks. That continues to be available. And if I could say anything to the aged care workforce, practically speaking, the greatest protection that you can give to those under your charge, under your care, and I know you care for them, it's to get vaccinated, to be fully vaccinated. That will be the greatest protection that you can provide to those that you're caring for in whatever setting. And I know that not all of you have been vaccinated to date and that there are multiple reasons for that. But if it's a matter of tossing up whether or not the vaccine provides protection for you and by virtue of that to those you care for, please come forward to get vaccinated now.
Time for a state, is it time?
Sorry, I'll just finish with you, Samay.
Is it time for a state government intervention in private residential aged care? And when you made the offer to the federal government, what was their response?
As I say, ready and willing to support the Commonwealth. We will remain available to assist with that as required.
Your understanding that since November, workers in federally administered aged care facilities have been permitted to work across multiple facilities, and if that's the case, should that have been allowed to happen?
Look, it's a question for the Commonwealth. It's a Commonwealth workforce. As has been stated, the ministers said that in public sector, in Victorian public sector aged care, there's been both financial support and a policy setting that has effectively prohibited work across multiple aged care sites. That's entirely appropriate. It is massively risky to move across different settings.
So it shouldn't have happened in the other sector either. It shouldn't have happened in the private sector either.
Look, it's a risk wherever it occurs, doesn't matter public or private, but the question of how it's effectively enforced, supported financially or otherwise in terms of policy is a question for the Commonwealth.
How do you feel about the fact that workers were allowed to work across multiple sites in federal-run facilities?
Look, it's not a question for me. I'm saying it's a risk wherever it occurs. There needs to be support and policy settings to minimise that to the fullest extent possible. I understand that some settings will have critical workforce issues if people can't move between settings, but the risk is manifest. And it needs to be minimised to the fullest extent possible.
You say you're drilling down on the data. What measurements are you using to gauge the success or otherwise of lockdown so far?
Look, clearly we're identifying primary close contacts really quickly and their close contacts.
I'm talking about lockdown as a measure.
Yeah, look, the real measure is not to have more cases, but if cases occur, to make sure that they are quarantining. We've seen increasingly that the new cases that we identify are already quarantining. That's a good sign. But there will be people who, for essential work purposes, for care and compassionate reasons, are still moving about. And so some new exposure sites will occur by virtue of that. We need to reflect on how many people are exposed in those settings and the sensitivity of those settings in terms of vulnerable people.
Are you seeing people who are secondary contacts testing positive but not the primary contact? Is that emerging?
No, we haven't seen that. We thought we'd seen it, but a secondary close contact was in fact a primary close contact at another exposure site. So it's not jumping ahead in that way, but we're certainly seeing the rapid identification of secondary close contacts shortly after primary close contacts have been identified. That's what has happened with the Bluecross worker.
And what sort of monitoring is the state, this might be a question for James, but what sort of monitoring of primary and close contacts isolating is going on? I mean, in the past we've had door knocking, etc. What has been done to make sure
there's a significant compliance and enforcement check-in and support for those people who are isolating at home or quarantining at home. ADF support is happening with that as well, and there are at least 600 visits that are planned for today.
Say that to as far as May 12. Does that mean we're any closer to finding the missing link, or can you explain why they've gone back so far?
We're no closer to identifying the crossover with the Wallert case from South Australia. We'll continue to explore that, but it's no clearer to us at the moment.
That May 12 case related to someone who'd worked at Slade Soft Drink Factory in Thomastown on May 12 and a number of dates up to May 28. Is this case 5 or is it someone who precedes case 5? And have we got a sort of Cedar Meats all over again situation where someone was attending a workplace for a long period of time while infectious before getting tested?
I might throw to Jerome. I'm not sure if you heard the question.
Sorry, Rachel.
Sorry, I'll try to repeat and I'll try to be succinct.
That's all right.
So the May 12 case, the case that dates back to May 12,
Yeah.
is that case 5 or is it someone who precedes case 5?
Mm-hmm.
And I guess how concerned are you that it appears we've got someone who was attending work at that Slade soft drinks factory for multiple days between the 12th and the 28th of May?
Yeah, so case 5 indeed is one that dates back to the 12th. During the course of this outbreak, we've identified now 3 cases where their exposure periods go back over a week, over 10 days from the point at which their test result came through. That means they're out in the community for a long time. It means they've got a large number of exposure sites. That, of course, is a major area of concern for us. The slightly encouraging picture over the last 24 hours is the new cases we've seen overnight are much shorter in period, and particularly the ones associated with the aged care worker. Because she got tested immediately, she had symptom onset on Friday. Her primary close contacts are also very short into their infectious period. So reduced number of exposure sites, that gives us obviously a much better chance of getting hold of this and putting it down.
So is it case 5 who worked at the Slade soft drinks factory? And if that's the case, you only identified that as an exposure site. Why did it take you from about Wednesday last week until the weekend to identify that as an exposure?
So no, I'd need to come back to the details. The case 5 is not that particular case. I need to come back and give you the details on that.
So you have found someone before case 5? Then?
No, we now have 2 cases that are adjacent to that 12th of May presumed infection point. Where there are 2 cases in mind, one of which was identified a couple of days ago, one of which is case 5.
And did case 5 then get the virus from that person, or they might have both got it from
So that is a leading line of inquiry. So we have case 5, we have case 1, and we have another case. I haven't got the number in my head. Who are all intermingled through a number of different exposure sites. We are still unscrambling that particular picture at this point in time.
So is the exposure site because it's the same person?
No, so we have. So bear in mind, and this is part of the challenge in this outbreak. We now have City of Whittlesea, we have Port Melbourne, we have, of course, the aged care facility. So as we're putting up exposure sites, they relate to positive cases identified with all those 3 clusters. So we're, from the point of view of what we're communicating publicly, the focus is on the exposure side. It's our job to work out then, when people come forward, how they're connected into the network.
How many positive cases have you had at Slade soft drinks then? Is it just the one?
I believe just the one, but we can confirm that this afternoon. Hold on.
Sorry, are there still industry testing guidelines?
Yes, there are. So there are a range of industry testing guidelines, obviously for the aged care sector, for the health services sector. We're continuing to work, of course, with some of those more sensitive settings, sensitive industry settings, and we're looking again at how we can surge some testing activity into some of those locations.
Case 5 is still the source case?
In regional Victoria, or are they all in Greater Melbourne?
No, so all the cases we've identified at this point, although we have exposure sites in regional Victoria, and of course a number of these cases are very close to that peri-urban fringe. They're in our outer suburbs, but we don't have any positive cases who reside at this point in regional Victoria.
Who's working at Slade's Beverages, do you know when they started showing symptoms?
I need to come back to you. I don't have the details in my head, I'm afraid.
Case 5 still the source case?
No, case 5 is one of our, we think at the moment is one of the earliest indicators of crossover cases with the Wollert case. We are still working through, as the Chief Health Officer said, exactly what that bridge point was. We have another case who was identified a few days ago who also goes back to around that point in time. There may be a transition point there. That's what we're working through.
And that case you're talking about, has it been linked to the Wollert van though?
So no, we're still working on what the exact bridge was with the Wollert case. So we've got a number of adjacencies that we can see between the Wollert case in terms of geography and the kind of movements they've undertaken. We've got a number of cases, 2 that go back to close to that period. We still think there is a missing case in there somewhere between Wollert and the positive cases that we've identified. And again, it highlights the importance. It is very important to come forward and get your test as soon as you're symptomatic, because it gives us a much better chance of running down where those infection points have been. Secondly, however, if you've left it late, well, still go and get tested. I would still rather know, even if it means we have to go back 2 weeks, any information we get about positive cases helps us to run this outbreak to ground.
Can we ask you some questions?
Sorry, Mike?
There's been a couple of bus routes. There's been
Yes,
a couple of bus
that's
routes
right.
identified as exposure sites. Do you know if there are any trains or trams? A couple of locations at Southern Cross train station have been
Yeah,
identified.
so at this point in time, based on the interviews, and again, bearing in mind these are from positive cases that have emerged in the last 24 hours or so, and a big shout out to our colleagues at Dyson's and CDC for the work they're doing. We've got 3 bus routes. Obviously, those buses are all being deep cleaned. We have a number of drivers going through the testing program, and really important, of course, it's another reason why for those of us using public transport, please register your Mikey. It gives us another opportunity to get hold of you when, in the unlikely case we see these cases pop up. Sorry.
Have we linked that first aged care case back? Do we know where that came from at this
So
point?
we're still working on the exact linkages between the aged care case. We will get genomic results, we hope, within the next 24 hours. That will allow us to be confident it's part of that same South Australian hotel quarantine kind of case that we're all focusing on with the rest of this outbreak. So we expect to have that within the next 24 hours. And again, we've got a number of interviews underway to identify exactly her movements and how that might cross over.
Going back to the Woolworth
Yeah.
case, he visited a shop called India Gate Spices in
Yep, that's
Epping
right.
on the 8th of May.
Yep.
So did a subsequent case
right.
that's part of this cluster, I
Yep.
think on the 19th.
That's
Are
right.
you looking at that as a possible
So
source
so
of
we're
transmission?
so clearly we've seen a number of our positive cases in the Whittlesea outbreak have visited places like India Gate and a number of other smaller community grocery stores. We're very interested in those stores at the moment, and that's why so many of them appear on our exposure list. And again, I would encourage anybody in the northern suburbs who's been to those kind of small local groceries, please come forward and get tested, because it'll just give us that bit more intel about what's happening. With particular reference to India Gate, Wollert and the subsequent cases, there's a 10-day, 11-day gap. We do not see that as a crossover point. It's obviously far too long, but we are still looking in that kind of space to see where else these crossovers might be.
And just one more question on the Woolert case. He flew back from South Australia on
Yep.
the 4th of May. He's believed to have developed symptoms on the 8th.
That's
He
right.
got tested on the 10th.
Yep.
There was a period between the 4th and the 6th where you guys didn't issue
Yep.
you didn't issue exposure sites because at the time you didn't believe that he'd been that he was infectious at that point, even though you knew he'd caught it in South Australian
Yep.
hotel quarantine. Do you now regret that, given that we are finding with the Indian variant that we've got a very rapid rate of transmission and some people are catching it and giving it to other people within the space of 2 days?
No, we've obviously gone back, and we're continuing to go back and look at all the movements of our Wollert case, and that's obviously a key line of our ongoing investigation. We have looked at his movements between the 4th and the 6th, and to establish if there's any other areas of concern. We do not believe there are at this point in time. We think there's a missing link between his movements based on the already identified exposure sites that we have, and that's what we're continuing to search for.
You had a point where you knew he'd caught the virus and a point where you knew he'd tested positive.
Yeah.
Out of an abundance of caution, why didn't you just publish all the exposure sites for the period between those 2 points?
Because
if you had your time over, would you?
No, I think at this point, everything we've seen, if you look at how fast and aggressively we've moved on this particular outbreak, if you look at the 279 exposure sites that we have listed out there for all the positive cases that we have there, 4,200 primary close contacts, we are driving exceptionally hard at this particular outbreak, including right at the very outset with the Wollert case. So I don't at this point in time, I'm not looking at anything that says we've missed a trick in that particular one. I am concerned, of course, that we haven't as yet got that crossover point. We haven't got that connection point. We think there is somebody out there who did have contact with Wollert and who then subsequently had contact with others in the clusters we're now seeing. We'll continue to search for that person. Yeah.
You have the legal instruments and the power to be able to ban aged care workers from working across multiple sites in private residential facilities?
I'd have to see with my legal team. Usually if there's a regulatory power that sits with someone else, you don't exercise a public health order if there's a more specific power that can be applied, but I'm not the legal expert here.
Have you had conversations with the Commonwealth and the health team there about the fact that people have been moving? Has there been communication between the two governments on that issue?
Not through AHPPC, but there will be others engaged in the Victorian Aged Care Response Centre who'll be having those conversations, I'm sure.
Given that we've got no cases in regional Victoria, should they expect to have a different set of rules come Friday?
We will see when we get there, but at the moment it's reviewing day by day. As I say, I don't know what might emerge tomorrow. There are still a number of primary close contacts in regional Victoria, a number who've tested negative, but we don't know what might be around the corner.
Are you considering sewage testing too? Is that still going on?
Sorry?
Sewage testing?
Yeah, sewage testing continues with a force. Obviously, we're still flagging where a detection pings, where we don't know that there are known cases, and we'll advertise those where they occur. But a lot of the positive detections we're getting, we know that there are primary close contacts who've become cases, and therefore it's not unexpected.
Not popping up elsewhere.
AHPPC in National Cabinet for the federal government to ban aged care workers from working across multiple sites?
Look, it's not come to AHPPC. It might be an issue that's brought up, but it hasn't to date.
Are you considering a so-called ring of steel separating the city from the country again?
Look, it's all to be determined as we go through a review of the situation day by day. But it is not out of the question. It is not locked in.
How soon can you know that this was a rule that the federal government are now not making it mandatory for workers to stick to a site?
We've known that there's been a policy setting from the federal government against workers moving across sites for a long time, but to the specifics of how high compliance is and what other enablers for that policy to be enforced or come into effect, I'm not sure.
So you haven't spoken to the federal government about your concerns?
No, I don't have those lines of communication. It is through the Victorian Aged Care Response Centre. I'm sure those conversations will continue today.
Premier, can we ask you about that, please? The Minister said that you've reduced the number of workers moving between. Mr Sutton said you've effectively stopped it. How is the state, as an oversight, understanding that the federal government is ultimately in charge, how has the state allowed any workers to be a staff member at one aged care and then work at another facility?
Well, I think that's been answered in terms of public aged care, and Minister for Health might supplement my answer in terms of our workforce through our policy settings and the financial support for the public sector. We've been able to have 100% of aged care workers in metropolitan Melbourne who are not working across multiple sites. And that's for a reason. These are high-risk venues. In terms of the settings that the federal government do not have, the fact that up until, I think, as recently as last Friday, there was the ability for workers in federal aged care, private sector aged care, to work across sites. That's a question.
Why didn't you step up and put a stop to that? Challenge the federal government.
Because the answer to that is public aged care is a responsibility of the state government. Private aged care is a responsibility of the federal government.
But at the end of the day, these are all Victorians, whether it's a state-run or a federal-run facility. Do you have the power to step in and change this, and have you?
Well, I might ask Minister for Health to add to the comments I've made, but it's a very simple proposition. Public sector aged care, state responsibility. We've got clear policies in place that has ensured that workers don't work across sites. Private sector aged care is a federal government responsibility. These are absolutely relevant questions everyone is asking. They should be put to the federal government.
It was a matter of great concern last year, and I think the public thought it was dealt with, that there was no crossover, and now we hear there is.
Yep, it's a good question. It is not happening in the public system. In terms of the settings that are in place in private aged care, you should raise those questions with the federal government. But I might ask Minister for Health, and then I'll come back.
So let's be clear here, this is not a particularly unique Victorian set of circumstances. This is a national system that applies across all of the Commonwealth. People may well recall in the very early outbreak back in New South Wales and Sydney, some of the issues that our New South Wales friends ran into in private residential aged care in some of those settings, and the challenges they had in responding to that framework. The Victorian public residential aged care system attached to our healthcare network. That is the area that the Victorian government regulates under the national arrangements. As the Chief Health Officer indicated, The system that is in place is based on our legal heads of power as to what we can and can't do in these sectors, and which is agreed through the Victorian Aged Care Response Centre, which I thank the Commonwealth for, and is operating again now and is doing a really good job. But we all bring our separate roles of responsibilities to this national pandemic, this global pandemic. And when it comes to residential aged care, for the vast time that this pandemic has been raging across our country, public residential aged care is the responsibility of the states. Private residential aged care is the responsibility of the Commonwealth. It doesn't really matter to the families and the communities and the workforce which is why we've established the Victorian Aged Care Response Centre model, so as to coordinate that effort. And as part of that coordination of effort, we have continually shared issues and priorities with our friends from the Commonwealth, and I thank them for their partnership. And as part of that partnership, we are now seeing the Commonwealth bring forward vaccination programs in some of these private residential aged care settings for both staff and workforce. So we welcome that.
It sounds like there's been a failure here though.
Well,
because COVID is back in aged care.
Well, COVID cases are back in our private residential aged care system, and that is not a good thing. It is a very, very serious thing, as Professor Sutton has indicated. These are high risk settings. I don't have to remind people in Victoria or Australia the disproportionate impact that COVID has on fatalities in private residential, in any residential aged care setting. And that's been the case in Australia, it's been the case right around the globe. That is why we have prioritised vaccination programs in those sectors in the public residential aged care sector. That is why they are in the 1A, 1B groups of the vaccination rollouts, because those are high risk settings. And what the Victorian government, indeed all the state governments, have been very keen on is to make sure that we work hand in glove with the Commonwealth to deliver support for our sectors and their sectors, and increasingly the responsibility of getting it done regardless of what sector you're in.
So given what we saw last year, how frustrated are you with the federal government that they've allowed aged care workers to work across multiple sectors?
Look, you're inviting me to be critical of the Commonwealth government in this space. I'm the Minister for Health. I know how the virus reacts. I know it doesn't make a distinction between Commonwealth and state facilities. What my job is to keep Victorians safe, particularly in those high-risk settings. There are multiple challenges to that every day, as we are seeing. Our public health team responses have been, for the past week, extraordinary. For the past year, extraordinary. We are keeping up with this, and I want to thank everyone involved. I will resist the temptation to be critical of the Commonwealth. Instead, I will work cooperatively with them every chance I get to get ahead of this.
The state has powers to essentially enforce quarantine requirements, even though quarantine is a federal responsibility. I guess, why does the Chief Health Officer or the state government not have any powers to be able to impose a ban on aged care workers working across multiple sites? You know, it's a public health measure at the end of the day.
As the Chief Health Officer answered that specific question before, we work through a national framework. We work through where's the most appropriate head of power. We've just had a royal commission into our aged care sector. It is beyond dispute that this sector is regulated, funded and overwhelmingly guided by the Commonwealth. In the course of a global pandemic, through the cooperative Victorian Aged Care Response Centre framework, where we all get together with a shared purpose of beating this virus, we share our issues and a cooperative approach in that regard. So I don't think it's right to say that this is a sector that is unregulated. It's where the regulatory power lies.
Aged care response centre meetings, has the Victorian government raised the issues with aged care workers working across multiple sites, and what was the federal government's response to that?
I believe so.
What was the federal government's response to that?
I'm not specifically aware, but I'm sure we could find out for you.
Has the COVID Safe app been used at all during this outbreak?
What?
Has data from the COVID Safe app been used at all during this outbreak, identifying any areas?
No. Not to my knowledge, and I'm sure at such a rare event, it would have been brought to my attention. I beg your pardon?
Do you believe that the lessons of the COVID outbreak in aged care last year have been learnt?
We're learning more about this virus and how it acts every day and in different settings every day. What we are also learning about is how people respond to that virus every day in different settings, in different ways. And we're also learning that the best way in which we can respond to that in a particularly Australian context is to secure our borders through dedicated, specific, high-risk quarantine facilities being built separate to hotel quarantine, and to avoid the kind of leakage that we've seen from the South Australian hotel quarantine breach that is at the heart of this outbreak. And on the other hand, we've also seen that the case is how we respond through managing high-risk settings, getting vaccinated, getting tested. It's up to all of us. It doesn't matter public, private, what the setting is. We all have a shared sense of responsibility to do the right thing here and overcome this breach and overcome this particular high-risk setting in our private residential aged care settings.
COVID transmission has changed quite significantly since last year.
Say that again, Svea?
What we know about coronavirus transmission has changed quite significantly last year, including, I guess we pay a lot more attention to aerosol transmission.
Yes.
What kind of an impact do you think that had in this particular aged care outbreak, and is that something you're reviewing in aged care facilities?
I'm not a virologist, so I'd have to be guided by the public health advice it is, but clearly, as we learn more about how this virus operates, aerosol transmission is increasingly an accepted reality.
Acting Premier, can we... A couple more at you, please.
Yeah, sure.
Just to lockdown, you say this may well get worse before it gets better. It sounds like that's a statement to prepare us for an extra lockdown or extra restrictions. What has lockdown achieved so far on day 4?
Well, I just want to be honest with people every step of the way. We are standing up daily, talking to the broader Victorian community through you all here about where we are right now. And where we are today is those additional cases that we've gone through, high number of primary close contacts, high number of exposure sites, very concerning number of very high risk settings. So I want to be clear with people that the next few days are going to be so critically important, and that includes the possibility that this outbreak will get worse before it gets better. That's the situation that we're in right now, and I want to be upfront with people to let them know that that's the case.
The numbers haven't come down significantly in the last couple of days, day by day. I'm just trying to work out what this lockdown has achieved so far.
Well, as Professor Sutton outlined, the ultimate goal of a circuit breaker lockdown is for our public health team to get ahead of the outbreak and for the cases to come down. And as Professor Sutton outlined before he had to leave, is that we are running neck and neck with this thing right now, neck and neck with it. So the next couple of days are going to be so critical, and I just want to say to people that it may get worse before it gets better.
He also said that contact tracing has this in hand. I mentioned to him that it was overwhelmed last week and he denied that, but he said contact tracing is in hand. If contact tracing is in hand, that's one of the major ways of combating outbreaks. Why are we now talking about the possibility of a longer lockdown?
Well, I'll get the COVID-19 commander to talk in some further detail. But we've got 2,400 people in our public health team. As I've outlined a number of times with this recent outbreak, our contact tracers are working faster than they have ever worked before. They are doing a brilliant job, within a very short space of time, identifying and locking down generations of cases. So they're doing a brilliant job. But we are seeing today, via the number of cases, the number of exposure sites, we are running neck and neck with this thing right now. Everyone's doing their very best that they can. The contact tracing team are doing a brilliant job, but right now it is neck and neck, and it may well get worse before it gets better.
Just a quick one on the QR codes. What concessions are you ready to make at this stage about the inadequacies of the QR codes and how it's being used by the general public for the last, say, 6 months?
Well, I'll ask the COVID-19 commander to talk about the QR codes. Yeah, sure.
You go first.
Thanks, Rachel. I know you said it's too soon to say whether the lockdown will be extended. What would be your advice to a couple getting married this weekend?
Oh, look, I appreciate the question, and for couples planning a wedding, I know that they'd be sitting on every word that is being said at these conferences, but it's just too early for me to provide advice. I think that would be completely unfair on anyone planning something special in the coming days. We're running neck and neck with this outbreak right now. We've got a lot of exposure sites. We've got a lot of high-risk sites that we are concerned about. The next few days will be absolutely critical. So, we'll have a better sense, as Professor Sutton has said, through the course of this circuit breaker lockdown, and we'll be able to provide advice based on public health advice. But right now, it would be unfair on any individual to speculate on what might happen.
What about schools? Could parents with school children be expecting a longer stint of home learning?
It's exact same answer. So whether you're talking about regional Victoria, whether you're talking about schools, whether you're talking about events or private events that are being planned, the message is the same. It is too early to speculate. This is a day-by-day proposition. There are a number of concerns that we've outlined through to the Victorian community today, and the next couple of days with this outbreak are going to be critically important.
The Education Union are pushing for teachers to get vaccinated. Will you consider getting teachers eligible for vaccination early?
Look, as I've said, we're very keen to expand eligibility for people that are eligible to be vaccinated. We want to do that as quickly as we can. We've had terrific take-up of the 40 to 49-year-old cohort as we expanded for that proportion of our community via the state sites. In terms of whether it's particular workforces or whether it's particular other age cohorts, that's going to be dependent on the confidence that we have in the supply. So that's
as Education Minister, though, are you looking at it for teachers?
Well, that will be based on public health advice in terms of what are the priority groups that should be next in terms of expanding the eligibility for the vaccine.
What variations of measures are you looking at going forward? Thursday, we're day 4 into day 7. Regional Victoria doesn't have a positive case at the moment, understanding that they do have contacts. What are the measures available to, or is it all or nothing for Victorians?
Well, it's entirely based on public health advice in terms of what may happen, what we may announce later in the week. But right now, it is a day-by-day proposition, and it may get worse before it gets better. In terms of any easing of restrictions, in terms of the timing of that, that is entirely based on public health advice. I appreciate the question, but I just can't speculate on what that may or may not be.
We had a 3-month roadmap last year where you could effectively predict and do some modelling and tell us what goals we had to aim for. Are we just simply aiming for nothing right now? What can you tell the public? What are we looking for?
It varies depending on the outbreak, and the Minister for Health might talk about this, or the COVID-19 commander, but there are a range of things. It's not just about the case numbers, it's the type of cases, it's where it's occurring, it's do we know where they're linked, are they high-risk sites? So all of those things are taken into account by the public health team in terms of when they're confident to provide advice to government that we can then go towards some easings of restrictions.
Last year was 5 daily cases and 5 mystery cases over a 2-week period. Is that something you'd possibly be applying, as you're making decisions about how long this lasts?
Rachel, my answer is the same. It's a range of things that will be taken into account.
Question for you with where we are at the moment. National Cabinet seems to be a benchmarking exercise and an area where ideas can be shared. Nationally speaking, why is Victoria, talking about aged care again, talking about being neck and neck with contact tracing, why is Victoria a leader, the capital for outbreaks and lockdowns?
Well, I think that is an unfair question. What we have seen right across the nation are breaches in hotel quarantine. Let's remember that this outbreak. Hang on a sec. Let's remember that this outbreak that we are dealing with right now originated from a hotel quarantine breach in South Australia. That's a fact, that all the genomic testing points to the outbreak in hotel quarantine in South Australia. Now, I've said we would not be in this position. We would be in a very different world if we had had a successful rollout of the Commonwealth's vaccination program. It would be a very different world if we had, alongside hotel quarantine, alternative quarantine arrangements for our highest risk cohorts that travel in from overseas. But we don't have that. What we have had is a breach after 86 days. After 86 days without community transmission in Victoria, we had a breach in South Australia that has led to this outbreak that we are dealing with right now.
But I'm talking about differences of another kind. South Australia, you have to check in, you have to do your QR code when you go into a supermarket. That's not compulsory here. New South Wales hasn't had the big broad lockdowns that Victoria has, and it has had outbreaks.
Well, in terms of
I'm just talking about the
understand the question. Understand the question, but every outbreak is different. Everyone who is positive with COVID-19, many do not transmit. Some transmit and are highly infectious. That is the nature of this global pandemic. We've had an outbreak from South Australia, travelled to Victoria, and now we are dealing with this outbreak. And what people want to see are the actions that we're taking to get in front of this outbreak as quickly as we can.
Sense that short, sharp lockdowns are better for the economy than lingering restrictions. Is that the mindset in the Victorian Department of Health at the moment?
Yeah, what we've seen in Victoria back in February, in other states and territories, or other states rather, a short, sharp lockdown, get in front of the outbreak as quickly as possible. And as the Treasurer outlined yesterday, we understand that there will be an economic impact of this circuit breaker lockdown, but we want to keep that impact for as short a period as time as possible. Sorry, have you got another question for me? Yep.
I've got another one for you,
Yep.
if that's all right. In regards to the Commonwealth not matching the state's business package, do you think that the Federal Treasurer is sending a message that it won't tolerate states overreacting with heavy-handed lockdowns? And do you think that you would have received a better response if the lockdown area wasn't so large?
Well, that's entirely speculative. You'd have to put those questions to the Federal Treasurer. The Treasurer and myself outlined Victoria's position very, very clearly yesterday, and I've got nothing to add to those comments.
Do you think if it was a smaller size that you would have got a better reaction from the Federal Treasurer?
Well, that's a question you should put to the federal government. I don't know their thinking in refusing to provide the support that we're asking for, that Vecchi is asking for, that businesses across the state are asking for. That's a question you'd need to put to the federal government.
About those things, when you were asking for the Commonwealth to match the package, did you discuss whether or not that they would have helped if it was a smaller area that was affected by a lockdown?
Look, we put to the federal government what we were seeking and the need for it. We put it to them a number of times. It was refused. I really have nothing further to add than my comments yesterday.
What exactly are you requiring from the federal government today?
Well, we put it to them that there needs to be support for Victorian businesses. Wage subsidy is a responsibility of the federal government. We're in a circuit breaker lockdown. Businesses are doing it tough. We don't have JobKeeper, so it was appropriate. We thought, we're putting $250 million bigger and broader than the circuit breaker lockdown's business support back in February. We think it's appropriate that the federal government provides support as well. In terms of why, in terms of their thinking, those are questions you'd need to put to them.
Acting Premier,
Whether they would have helped if you didn't lock down regional Victoria, which now doesn't have a COVID case?
That was not put to me.
Extending for another week is still very much on the cards. How long can Victoria go without JobKeeper or more financial assistance from the Commonwealth? And have you had further discussions since the sort of rather boisterous presser yesterday with the Commonwealth?
Well, this is it's a devastating time for businesses, and we absolutely acknowledge that, and that's why we delivered a bigger and broader business support package than we delivered in February, and we'll deliver it as quickly as we can. Businesses are able to provide an expression of interest in terms of it. There'll be applications open no later than Wednesday of this week, and businesses, the first payments will start by the end of this week. So we know how tough businesses are doing, and that's why we've provided $250 million of support, and we feel that the federal government should also support Victorian businesses.
You say contact tracers are neck and neck with this outbreak.
Yeah, that's what Professor Sutton has advised.
We've seen with previous outbreaks, contact tracers and other processes have been able to get on top of it by now with this length of time. What's different this time?
Well, every outbreak is different,
So what's
and the
different
main
this time?
answering the question, mate, and the main purpose of this press conference today is specifically to go into some of those higher risk settings that we are very, very concerned about. So the number of exposure sites, the fact that it has now entered into some very high risk settings, these are things that are very concerning to us, and that's why I wanted to be upfront with the people of Victoria.
And the variant,
that the
you haven't said much about
and
the
indeed,
variant.
and,
Yep.
and indeed the
What can you
variant.
tell us about that?
About the variant?
Yeah.
What we know of this variant is that it is more virulent than other strains of the virus. So it's a variant of concern. It's in high risk settings. We've got a number of exposure sites, and as Professor Sutton has outlined, our public health team is running neck and neck with this thing, but the next couple of days is going to be very, very critical.
Premier, vaccinating some of our frontline workers, quarantine some healthcare workers as well. Do you have a stat on how many of them have been vaccinated by now?
In terms of frontline workers,
Frontline workers who were responsible for?
COVID commander.
I didn't get the question when he was on, great.
How many of the frontline workers the Victorian government is responsible for vaccinating have been vaccinated?
In public sector aged care?
Public sector aged care, quarantine workers.
Sure. So, look, I can absolutely confirm that, of course, there's a requirement for anybody working in our state hotel quarantine system has to be vaccinated. All of those staff have been vaccinated since before Easter time, and that program is continually refreshed to make sure those vaccinations stay up to date. In terms of public sector residential aged care, we have over 17,000 vaccination doses that have been delivered within this wider state public sector aged care system. 4,500 staff in the system have received their first dose. We are 2/3 of the way through the second doses, recognising that many of them are on AstraZeneca, so that'll take a bit longer. And we have obviously very high levels of compliance between the staff and the public sector aged care system being up to date with their vaccinations.
In terms of the percentage though, is it 80% of staff, 90% of staff,
Yeah,
and
so
across the board, not just aged care workers, quarantine workers, for example?
So hotel quarantine workers is 100%. There's a requirement, and it's part of their conditions of service within the system. Within the wider health service, we had critical health service workers who were part of that original phase 1A vaccination rollout going back to February. All of them have been delivered, and of course recognise there'll always be a little bit of churn as people come into roles and move out of roles. Of the wider healthcare service, I can give you numbers later on, but over 80-85% of wider health service workers, hundreds of thousands of people across the state have been vaccinated. That includes our public sector residential aged care workforce. Just to highlight that, we started our public sector residential aged care vaccination program back in February. We completed the first round on the 19th of April. We continue to update it as we go through our second dose cycle.
Amanda, can you confirm that a second school has closed, a primary school in Craigieburn?
There are currently, look, as I think I indicated earlier, we have a number of cases currently under investigation today based on testing results that came in the early hours of this morning. They're not part of today's numbers. Those cases are still being followed through. We have 3 schools that we're currently working with at this point in time, out of an abundance of caution, if those cases are confirmed to be positive, if the preemptive contact tracing work is already underway. That's how we operate, which I think goes to your questions earlier.
What do you know about the case from the Craigieburn, Wilmot Park Primary School in Craigieburn?
Yeah, so we've got Wilmot Park Primary School, we've got Mercy College, and we have MLC as well. Those 3 schools are all associated with 3 possible cases. Those 3 possible cases, I stress possible, are household contacts of a confirmed case. We're doing repeat testing on those cases at the moment. Those details will come out during the course of today. We'll confirm those tomorrow.
Just on QR codes, as I asked the acting Premier before, what concessions can you make at this stage about the inadequacies of this and whether or not they've let down those contact tracers?
None.
None?
No.
including the supermarket, where there was
What way?
the wrong supermarket was identified?
Well, that's not a QR code system. That's not a QR code failure.
Could it? Well, my question is around QR codes and how the system might work better then.
Sure, but that's not related to the supermarket. But happy to talk about QR
Yeah,
codes.
sure.
So,
What changes would you like to see?
So, well,
happen to
the
QR codes?
changes we made to our QR code system was, a number of weeks ago now, to move everybody onto the Services Vic platform. That makes it easier for people to comply. It makes it quicker for us to get hold of the data. One of the reasons we've got 4,200 plus primary close contacts as quickly as we have, one of the reasons why this outbreak has been followed through so quickly as it has, is because we have at the base of it a decent level of data capture on the QR code system. Would I like more compliance? Absolutely. And one of the key things, I think the weather change we've seen in the last 8 days has been an environment that says we're no longer living in an environment where we've had 80 odd days of zero community transmission. COVID, as we've been saying for months and weeks, continues to be alive and well in the wider world. It continues to rage in every other country outside of Australia and New Zealand, and it is always a threat to our community. We're seeing that play out now. That is why those core COVID-safe behaviours, get tested early, comply with those QR code systems, and when you can get vaccinated, when you're eligible, please take it up, are just so important.
Would you like to see the state make it more compulsory in different areas like
No,
supermarkets?
I think it's very clear. There's two things. One is it's very clear, and we base this on public health advice around where are those locations where we think it is really important for people to comply to QR code systems. We've stepped up massively in the last few weeks the enforcement program again with businesses to remind businesses of their obligations in this space to make sure that their customers are doing the right thing, and I don't think that's a difficult thing to ask for. We want to make that appropriate and scalable to the settings we're in. I'm delighted that organisations like Coles and Woolies have also adopted that on a voluntary basis, and they're encouraging people to do it. Fantastic. The more data we get, the better.
How close are we? Just make it compulsory then. If the more data you get, the better. Why other states are doing it? If you can't buy anything in some of these other states without checking in.
Well, look, I
I
think the issue, Rich, is it's compulsory in the vast majority of settings that we're concerned about. We have seen, and we've talked about it for weeks and months previously, concerns about levels of compliance. None of us wants to go in heavy-handed and say, you must go and do this. None of us wants to crack down on business because business is doing it tough at the moment. None of us wants to put additional burdens on. Hang on. Do you want to stand here?
No.
Okay, all right. So none of us wants to put burdens on businesses that are disproportionate to what's going on. But I think for all of us, this is the reality that we have foreshadowed. This is a wake-up call. The challenges we have within running this outbreak to ground. Bear in mind, back in February, we were the only jurisdiction in the world that ran down a UK variant outbreak in the wider community. We are now the only jurisdiction in the world that is dealing with an Indian variant in a zero community transmission backdrop. And the challenges for us this week are to run this particular variant to ground. Nobody else in Australia has done that. Nobody else in the world has done that. Shall we come back to the question?
Staff working across multiple sites. Is there no legal powers for the Victorian government to make a legal direction saying this cannot happen?
Rich, I appreciate the question, but Professor Sutton and the Minister for Health have both gone to this question, so I don't have anything to add.
Just tomorrow is June. Is the Premier going to be back tomorrow? He said he'd be back in June. Is it tomorrow?
He won't be back tomorrow. He did release a statement that he's hoping to be back in June. That'll be based on doctors' advice. I'm hopeful that that is the case. He's recovering well, but he's not recovered fully. So that's why it'll be based on doctors' advice, but hopefully we'll see him and in June at some stage.
Speaking to him?
Of course.
How close are we to cancelling international flights coming into Melbourne?
We haven't cancelled incoming flights in terms of our hotel quarantine system, or indeed the repatriation flight that came in from India on Thursday. So there's no cancelling of those flights.
A couple of weeks ago, Jerome Weimer had said that we weren't meeting our vaccination capacity essentially. We had lots of vaccines, people weren't coming forward. Are we meeting that capacity at the moment?
Yeah, so Jerome might want to speak to this further, but we've had a great response, whether it's Victorians coming forward getting tested or eligible Victorians coming forward to get vaccinated. It is always based on the supply that we have and our confidence in future supply through the Commonwealth. We've got confidence of around that 20,000. So at the moment, we're tracking 20, 18, 17,000 a day. We can deliver that and we've got confidence in delivering that. In terms of going further, which we would love to do at our state sites, that'll be dependent on our confidence in supply.
Do you want to see vaccines made mandatory for all aged care workers? Do you want to see vaccines made mandatory for all aged care?
That's already been answered.
I mean, just quickly on aged care staff, one of the women who was arrested at the anti-lockdown protest on the weekend that coughed on one of the camera crews was an aged care worker, has not been vaccinated. What do you think should be done in that case? Should people like that be allowed to work in the... I know it's not mandatory, but you have to ask that question. Should they be allowed to work in aged care?
Oh, look, I just respond to people gathering in that particular gathering. It's irresponsible. It's incredibly selfish, and I think authorities have dealt with it in the appropriate way.
But do you think that vaccines should be mandatory for some workforces?
Well, we've made a call in terms of vaccinations mandatory for hotel quarantine workers, and that is absolutely appropriate. In terms of other cohorts of workers, that's already been answered.
Mandatory for hospital workers, and there are reports today that casual staff, including nurses at the Dandenong Hospital who haven't yet been vaccinated, are being sent home. That's apparently not happening at Eastern Health. I guess, is there a blanket rule? And if so, there will be some people who are pregnant or have, other conditions that mean they can't be vaccinated. What's the situation for them?
So on that question of health care workers, I might defer to the Minister for Health. Thanks, Martin.
Thanks, Acting Premier. So you're right, Rachel. There are some groups who are perfectly legitimately able to turn down the offer of vaccine, pregnancy being a case in point. All the healthcare workers in the public healthcare system and in the what was referred to as groups 1A and 1B, we've had very high rates of vaccine take-up by those groups. As the Commander of Testing and COVID Response indicated, there have been, as a result of churn and maintenance of work groups, catch-up issues with a few. We've found overwhelmingly that our public healthcare workers, more than any other group, appreciate the importance and the need for vaccinations, whether it's COVID in years gone by, flus, and other vaccine programs. What we've found in, I think, the circumstances you're referring to, is that there is a very small number in those groups that need to have the system maintained and have, in particular circumstances, legitimate reasons for knocking back the vaccine offer. Out of an abundance of caution, as we've stepped up the COVID response standards, now that we have active community transmission, we've asked all of our healthcare facilities to raise the bar as to what their COVID response status is, and the circumstances that you've referred to reflect that.
I'll just back on my question about the rules about aged care workers working across multiple sites. It's in your directions that the CHO actually has the power to stop people working across multiple sites. It came into effect on Thursday. So,
if I understood the question right,
you keep saying it's the feds, but it's in your actual directions that the Chief Health Officer
recommended,
yeah. In the directions that were published.
Correct, but it talks about a recommended position. And that reflects the position that has been consistent right throughout this global pandemic's implications in the Australian aged care sector's circumstances. I don't think anyone argues the toss, particularly at the Commonwealth level, that the regulation and the system for managing COVID in private residential aged care is the responsibility of the Commonwealth. And in terms of relying on state orders, powers more generally, that has been reflected in Victoria and in the other jurisdictions in a similar way.
Victorian government can make restrictions and bans and arrangements on visitations in private residential aged care. How is it possible that you don't have the power to enforce aged care workers to not work across multiple sites? You can enforce bans on visitations. You can enforce, you can enforce the private residential aged care to change their arrangements in response to an outbreak.
I think you're inviting me to do two things. One is to be critical of the Commonwealth, which I'm not going to do. I'm going to work cooperatively with the Commonwealth to address a real problem. And on the other, you're inviting me to, on the run, reframe the regulatory framework that is applied for COVID responses right across the Commonwealth in private residential aged care for some 14 months. Clearly the Victorian government's and indeed all the state governments and territory governments' powers when it comes to pandemic responses are broad and significant. But they also try to be as consistent as possible and in line with the national direction set by National Cabinet. And in this regard, without doubt, the Chief Health Officer's powers are very broad, but they also need to be appropriately reflected against the national consistent policies wherever that applies, and that is in the case of private residential aged care.
But we've seen how devastating it is when COVID seeps into aged care facilities. We saw what happened.
I missed the first bit.
We know how devastating it is
Absolutely.
when COVID enters into private, aged care facilities. It's happened again. Isn't the proportionate response to ban aged care workers from working across multiple sites and making that, I guess,
which is what we've done.
Applying that across the board as opposed to just the public sector?
Okay. We had a system in place through the Victorian Aged Care Response Centre in both public and private systems that achieved precisely that. The state made a policy and financial decision to continue that. You'd have to ask the Commonwealth what the reasons as to why they didn't continue that policy, which I understand now they have re-established, so we welcome that. We welcome that strongly. But in regards to the broader policy issue, I refer you back to my original answer, that this is a consistent approach across the states and territories, and if it's going to change, our preferred position would be to do it on a consistent national basis.
Does it need to change then? Does it need to change, and will it be something that you push for at National Cabinet?
Oh, well, I'm not on National Cabinet.
Government is.
But yes, clearly the government is. But National Cabinet's agenda is, I think, organic and fluid, and it would be a position that states and territories, through health ministers, through aged care ministers, through discussions with the Commonwealth, I'm sure, would land in an appropriate space.
I understand that people would be absolutely shocked that this is still happening.
Yes, I would.
Yeah.
But is it something that you'd be advocating for to take to National Cabinet and for National Cabinet to have this discussion?
Well, the agenda for National Cabinet is a process that is led through states and territories agreeing, and would obviously, as circumstances change, look to how that agenda changes.
Have you spoken to other state and territory leaders about potentially bringing this on the agenda then?
That last bit again?
Have you spoken to state and territory leaders to potentially bring this on the agenda?
Well, I haven't spoken to state and territory leaders, but I speak
Maybe
regularly
it's a
to
question
health
for-
ministers, both state and federal, and issues around demand on the healthcare system more broadly that every state and territory is facing, and the application of issues around the vaccination program are well and truly on the National Cabinet agenda. Lessons from circumstances that continue to apply, I'm sure, might well make their way through the system. Everyone happy? Thank you very much.
We've received reports that, I'm not sure if this is for yourself or the acting premier, we've received reports filming's been approved to go ahead in Port Melbourne during lockdown. Is that the case?
Is
that the case?
That a building has been approved?
Filming has been approved to go ahead in Port Melbourne during lockdown.
Building.
Filming.
Oh, filming, pardon me. I'm not advised. I'm sure we could find that out and let you know.
There's at least 30 people there at a time when kids can't have more than 10 at their funeral.
Well, if there's been exemptions, we've seen during previous lockdowns that exemptions can, and under certain circumstances, subject to public health policy, be addressed. Then I don't know the particular circumstances of this one, but I'm sure we'll get the details back to you all who's expressed interest. Thanks, everyone.